he's
And does he? So what part of his body does he
feels like
concentrate?
his arms are little twigs. He feels like they look tiny. He can look at them
Okay.
and see that they are small. Then we grab a measuring tape and we measure his arms and we
But
compare it
what
to.
was the
and then we
reaction
measure.
of his parents when he was?
His mother is very self-absorbed.
Mm-hmm.
His dad is. He's there. He's actually very caring. His father is.
But the mother wasn't.
Mother is not.
Okay.
She cares about herself and what she thinks.
Mm-hmm. Up to this day.
Up to this day, she's a very arrogant.
And does she live somewhere else? Do they have a relationship?
They
at
had
all?
an enmeshed relationship until I started pointing out specifically that she was doing everything she could to make all of his relationships difficult.
Mm-hmm.
And it wasn't about him; it was about her.
Mm-hmm.
And
so, although he's a big man and he's into sports, so when he was growing up,
he's an athlete.
So when he was growing up, she didn't really pay attention to all his.
He's like, I got a football game, and she's like, I'll be there, and then she didn't.
She never showed up. Okay, and he kept doing what he think
and he
was.
still talks to her. She talks to him. I mean, and if he won't call her because he's gotten to where he's getting where it's like, I don't want to deal with her today.
Mm-hmm.
You know, and his little sister has turned out to be just like her mother. They talk to each other and they call one another and they've got a close relationship. I just don't think it's a healthy one. And he used to do it to them too. Pick up the phone, hi, talk about me. I'm talking about me. I'm the only thing that matters. Yep, you said something, but I don't care because I'm talking about me. Me. And they're on the other
because
side.
Mommy Mommy didn't see me. That's the thing.
And that's what they do. They just
honestly, I always say that the body dysmorphia.
And this one over here is me.
For me, body dysmorphia, as a person who did psychology who did psychology in undergrad, I think the bottom line is it's that. Because if you read more about Bowlby and Ainsworth's work about attachment. It's can I finish my thought just a second? Let me finish my thought, please. When they talk about the reactive attachment disorder, it's people think about abuse, but the neglect is as devastating than the abuse, and it can turn into abuse because you will keep neglecting your child emotionally, because that's emotional abuse. And that was the same thing for the thing about the person who likes the eyes, because yes, there was food.
That kind of turns into abuse, self-abuse.
Yeah, self-abuse. Yes, there is food. Yes, I could watch my favorite shows. Yes, I could eat good foods and stuff like that. But emotionally, I was neglected. And for better or worse, that shaped the person I became. And I became obsessed, quote unquote, with my eyes. And I want, because in a way, it's easier to focus on that than focus on the pain. Almost like Flora.
Yeah.
Easier to focus on that than the pain.
You're very psychoanalytic.
Yeah, thank you. So
you're good at it.
So your husband needs to find a way to repair that relationship with his mom if he can.
I don't think he can. He's tried because
find another way, or find a motherly, so maybe provide.
He's got a stepmother that's been in his life for a very long time.
Is she
good? Very good. She's very stable. She's demonstrated sexist roles.
But the thing is, he needs to be able to express it, in a way to say, okay, I know I cannot get that from my mom, but my stepmom is giving me what I need.
Yep.
So if I was doing, so to conclude this, I'm going to say, okay, so Elizabeth, so what we're going to do, I'm going to invite you to come to some sessions that we have. We have an 8-week session program where we can talk about the problems that you think that you may have with your eyes and stuff like that, and how we can help you develop a better self-image, because you are a beautiful person, you have beautiful eyes, you wear beautiful clothes, you smell nice, so but still you feel that you're not worthy. So I want to of that, attention or whatever. So I want to help you develop a better self-image and have a better self-esteem. Is it something that you would like to consider? That we can talk about it and then help you overcome that wash to make your eyes better because they already look nice. So I want to invite you to explore the reason why you are
I
a
suppose I
little.
could do that because I'm not eligible for surgery yet. But
Okay.
once, that's probably. So I could probably,
So
that
you
would be
think that you
okay.
can find the time the next
Yeah,
few
I think
weeks?
I could do that.
Okay, and if there is a need for you to get to surgery, so by that time you will be able to reassess, if you need to go to surgery or not, or if the beautiful eyes that I already see, you see them the way I do, and then you can reevaluate the need for surgery or not. How did that sound?
I don't. Maybe if there's some exercises or something I can use. Because remember, she has no inside.
Okay, so but yes, we have some exercises that we can do. It might not be the kind of exercise you're thinking about directly, but definitely during
if it
those
helps.
8 week sections, we will have some exercises that we can do that will be tailored to your particular needs, and we can work on that.
There you see. That's exactly what you say. You sell
Okay.
them on whatever they want to hear.
Exactly. Yeah. And so, how does Thursday 10:30 sound for you?
Oh, do you have anything earlier?
Like what, 9:30?
9:30 sounds good.
Okay, that's right. So that's the plan. Okay, Elizabeth. So nice meeting you. So we'll see each other again next Thursday at 9:30.
All right. Cool.
Yeah, cool. So
I
that's
got
what
to
I was
diagnose
saying.
schizophrenia at my practicum site.
Did you?
Yeah,
Wow.
schizophrenia is so
I
hard
know, and I
to
cannot.
see.
But this is one of the diagnoses that I have issues with. Not the diagnosis itself, but the fact that there is not a better way to help the people help themselves. Because how can you say to a person who's schizophrenic to make the decision to take their pills or to come to
especially
buy
if it's mild
when
schizophrenia.
they don't have the clear insight. The person doesn't have the insight, and you want to give them the burden, and then you let them go in the streets killing people or killing themselves. I don't get it.
And see,
That part to me is like, it's crazy.
I've met several
I'm not saying that they
schizophrenic
should be
people.
committed, but at the same token, I think they
There
should be
needs to
shadowed.
more resources.
They should be
available.
more shadowed so they can, if they're going to sleep,
And then there's
somebody
this,
can help them.
There's this line between autonomy and self-determination
Yes,
and what is necessary to support the client.
exactly.
The client, if they go over here, this doesn't matter.
Mm-hmm.
And if you try to push this,
Mm-hmm.
there's nothing you can. And that's something that actually one of
Yeah.
the therapists. That was my ethical dilemma that I'm going to write
Mhm.
about. Is she has a highly schizophrenic woman
Mm-hmm.
who is off of her medication right now because she's
Mhm.
pregnant and she's going to deliver at any time.
Mm-hmm.
When she's on medication, she is fine.
Mm-hmm.
She can exist with
Mhm.
minimal supports.
Mm-hmm.
This is her fourth child. Every
Mhm.
time she's pregnant, she goes off of her medication and
Mhm.
she becomes incredibly unstable.
But what is the support system for her at that time?
But the dilemma is she's autonomous adult, she's self-determined, has every right in the world to make her own choices regardless of the mental status that she's in.
So that's the part that I don't get, because she's not.
mean,
She's delusional. So
she's
how can she be self-determined and autonomous when she's delusional? That's that part that I don't get.
Because
Why they cannot find another way to word the law
because
so you can
that's
give the
way
support
this
to the
woman
person.
perceives the world. She's in mental health court right now, and she's mandated to the therapy appointments.
Yeah, but she can be self-harm. She can do self-harm to herself.
To the baby that's going to be
so that's what
born
I'm
at any
saying. So how
time.
can be she
She
shadowed?
attacked her parents.
Yeah.
She just moved into their attic one night while they were
Yeah,
sleeping.
and then they're going to say that, she's still autonomous. She can do whatever she wants. I don't get it.
Exactly.
I don't get it.
And that's the ethical dilemma that I'm going to write about in my paper.
That's why I don't want to deal with schizophrenic people, because I think that
The
I'm
schizophrenic
doing,
woman I
but
saw.
I'm doing them a disservice by,
Because you want to take their rights away.
exactly.
Yeah.
I don't want to take their rights away, but at the same
And
time,
that's the
I want to be
therapist-
shadowed them.
That's just this therapist's dilemma, is that this particular person is in such a state that they are not making good decisions
For
at all.
Yeah.
And she wants to take her rights away. I mean, she can't. You can't.
And it's so complicated too.
This woman has done nothing to want her rights to be taken
even
away.
if you can take the rights away, the process is so complicated that halfway you're going to become insane yourself.
Exactly.
So,
Now,
so
but the
it's
schizophrenic
like
that
a
came
catch.
in-
How do you say that? Catch
Catch 22.
Yeah.
Yes. This woman that came in, she came in and was really kind of adorable. She's actually
Don't
quite
forget
sweet.
you have 5 minutes before you go.
Okay, but I got to tell
Yeah.
you about the schizophrenic
Yes,
that came in.
yes.
She was adorable
Mm-hmm.
and absolutely no threat whatsoever. She was in her late 20s, early 30s.
Mm-hmm.
She had an 8 or 9-year-old son.
Mm-hmm.
She was in a long-term relationship with this man
Mm-hmm.
who was always very thoughtful, very caring. Okay, she's been pursuing. She has a very hard time keeping a job, and people around her keep telling her she should apply for disability.
Mm-hmm.
This makes sense to her. This sounds like a sensible thing to me. She can't keep a job. Why can't you keep a job? Well, my back hurts. When my son was born, they gave me an epidural here on my back, and it's been sore since. And it's really hard to move sometimes.
Mm-hmm.
Well, where exactly? Here? No, I think it was up here. No, it was down here. Yeah, it just hurts here. Okay, so this is like, okay. So why are you here in a mental health evaluation for your back? Well, they said if I'm going to apply for Social Security, I need to have all these evaluations. Well, yes, that's true, but normally Social Security sets these things up for you. Who referred you? Well, the doctor did. The doctor said I needed to come here and get this for my Social Security.
Wow.
It's like, okay. So then I'm going to ask you these questions. We're going to do a full examination. I'm going to ask you a lot of questions. Some of them won't make sense. Please just go with me. We're going to just go. We're just going to answer them. And so she's asking the assessment questions. And we're into it a half an hour. These sessions are about an hour and a half long. We're into it about a half an hour. She's just talking about, she does have some marijuana use, just about daily. That's her baseline functioning, is to have a joint in the morning. Okay. If she doesn't have money, she doesn't smoke pot. It's not a big deal to her.
Okay.
They do use cocaine like once a month on payday, every other payday, because that's their recreation. They don't go to movies or nothing. They use coke, and they talk all night long about their thoughts, their dreams, their aspirations. Okay, so there's some substance use there. So how often do you use? About once a month. Does it cause financial problems? No, but no. It doesn't cause financial, so you smoke weed every day. Does it cause any issues with, no, we're not, so when you're not working, do you still, well, we won't use the cocaine, and we will cut back because we can't really afford it. So they're using heavily, they're not abusing. It is there. It's not a factor. So I'm just like, so that's something that's hard for me to come to terms with, that drug use is normal in some people.
That's how they regulate.
Yeah, that's how they maintain.
Yeah, that's how they
so we're
regulate
talking,
themselves.
and we're talking about family history. So we get to the family history,